I'm Dr. Manuel Sanchez Luna, I'm Medical Director of the Neonatology Division in Hospital Gregorio Marañón, Madrid, Spain, and also the President of the Union of European Neonatal and Perinatal Societies. Well, the scenario is changing very fast because, as you know, Europe is not a country, but it's, a lot of different countries and cultures all together. What we try in our society is to give as much as possible and uniform care in all of the countries of the European Union. What we see is there are a lot of difference between the East and West, North and South, and this is very difficult to uniform all of these situations. So the care of the perinatal care is improving a lot from the last few years. We are taking more care about prevention of prematurity and prenatal asphyxia, of course, but again we are facing a new situation, is the increasing the age of the mothers having their kids, their childs, during the last few years. So we are facing a new situation in Europe, what is an increase in the age of the mother. So this is going to give to us the new scenario of increasing the prematurity rate and more problems related with this increase in the age. So this is a new situation for us. We are decreasing in most of the northern countries and the eastern countries the age of those mothers, and then we are facing this new increase in the prematurity rate. So this is for us the more challenging situation. One of the biggest problems in Europe, as you know, is every country has their different laws, but even in their same country they have different laws in different areas or regions or locations. So this is extremely difficult. What we try is to send to the European Parliament at least what we feel is the rights of the newborn and the rights of the mothers, to have at least what we say the minimum healthcare system to all of them. And for us this is an extremely difficult situation. Again, we are facing the new problem as many refugees and many immigration is coming from the south to the north, and this is going to imbalance what we call the equilibrium in between what we have to give to all of the patients, at least this minimum health care system. So what we try is to say and advise to the politician that in Europe we have to give the minimum health care to the mothers and the kids and the babies and the newborns in the whole European community, but it's of course very difficult. Where the most important challenge is the differences in the economic rate of many different countries, the culture, and of course what we call the human rights in different areas of the European Union too. We don't have the same equilibrium from north and south, east and west. So what we try is to at least give the minimum resources to all of the countries to give the best healthcare system to mothers and kids. So what we are trying to focus on the family rights, at least to give to them the best scenario to have an increase in the healthcare system. This is extremely difficult and very unpolitical decision to me to say, but if we look at France, for example, or we look at Spain, or we look at Italy, or we look at the European area in the northern countries, then you probably will look at the best scenario for what we call the best healthcare system. That is gratuity for everyone, is universal, and is very in a very good equilibrium in between the citizens. So this main group of countries, including Germany too, is probably going to be the gold standard system of the European Union health system. Those beautiful countries, they have a very, very good situation because their economy is very high and the numbers of citizens are very low. So it is very, let me tell you, easy to give the best health system to all of them because they have very, very high resources in a very, very low number of citizens. When you look at the south of Europe, then things are completely different because the lower economy resources and the higher number of people living in those countries make to them a more difficult situation to have a very good health system in those countries. So Northern is probably one of the ideal area where most of the European countries are looking for like a mirror to try to simulate their situation. Well, probably Sweden is the best country to be among, why not? But also you can go to Spain, where you will have, what we call one of the best health system in Europe. Because all of the people, all of the citizens of Spain, and even anyone who is having a child in Spain are going to be covered by our health system. And the health system in Spain is extremely good. It's one of the best systems in the whole European Union. So, of course, being a mom in Sweden is going to be very good, but also you go to Spain, you're going to have one of the best health systems in the world. Well, the neonatal care is extremely good. So let me tell you something. For example, when we try to compare, when we are comparing different health systems in the world, we look at the percent of prematurity. In our country, we are having one of the lowest prematurity rate in the world. We are close to 6.3, 6.7. But one of the biggest problems is that from 2009, we were facing a tremendous financial crisis. And because of that, we increased the number of prematurity deliveries in our country. Now we are facing an increase in this prematurity rate, and now we are having 7.5. But if you look at the United States of America, then the prematurity rate is close to 12%. So this is giving to you an idea that in the whole European Union, we are facing a very good health system situation. And Spain, probably we would say we are in this first one-third group of countries that are having the best healthcare system in the European community. What we try to do is, first of all, look at any of the countries. Look at how is the health system in any of those countries. And try to look if we have to increase any kind of help in training doctors, training nurses, or training faculty of any kind to improve the knowledge of the perinatal care. And this is including not only the obstetric, but the neonatology care. So this is the first thing, try to improve the care and the training of those people. Secondly, we look at the laws, and we try to at least have the minimum level of right to all of the families having this kind of problems about inequity of prematurity rate or perinatal asphyxia or whatever. So we try to look at how those countries are facing this situation. And then what we try is to make some recommendation to the European Parliament to give to them the idea that in Europe we have a lot of differences between different countries. This is one of my favorite topics. What we try is to transmit that we can prevent lung damage to the premature newborn infant given less invasive respiratory support. Now the new devices, the new ventilators are helping babies to breathe in a more smoothly way, in a more friendly way. So what we try today is to do not intubate the baby, but if you have to intubate the baby, give the best respiratory support as possible and try to decrease the lung damage. So now what we are trying to use is smart devices that is helping the baby to breathe in a very friendly way. So this is the topic I'm going to discuss. We are going to transmit to the audience is that we have new recommendation from the ILCOR 2015 in October to how to manage different situations during the resuscitation of newborn. And this is what I'm going to transmit, new messages that is going to help the daycare of all of the people who are taking care of neonates in the delivery room. Well, the message is going to be decrease the damage to them, try to maintain the temperature as the best possible to prevent hypothermia. Do not aspirate into the trachea of those babies with a meconium risk of meconium aspiration syndrome. And some topic about cord milking and delayed cord clamping. The future in neonatal care is spectacular because our specialty is one of the youngest specialty in medical care, and we are going very fast in taking care of our preemies. But the most challenging situation is to decrease the prematurity rate, and mostly those babies were delivered in what we call the area where the survival, the viability is the lowest, is in between the 22nd and the 26 weeks of gestation. So that's going to be the most important and challenging situation, to decrease the consequences, the sequelae of those babies born too early in those weeks.